Hi friends, Dr. Nancy Trimboli here, putting the power and knowledge of your health back in your hands. So, the question is, you do something silly, you have some kind of injury, some unfortunate happening, and you think, oh my gosh, do I need to go to the ER or should I go to the chiropractor? Well, good question, because I do not do crisis care. So that means that if you are in a crisis, if your life is in danger, don't come to my office. You need to go to the emergency room. And as a disclaimer, when in doubt, seek emergency medical care first. When you get the all clear, please come on by. But there are a few things I wanted to mention. If you are bleeding and have some kind of injury where you're bleeding, please don't come into my office. I do not have the facility to handle that. Go to the ER or some kind of medical care. The other thing is if you have a very high fever, which is unusual, and you've had it for a number of days, you probably need to seek medical care for crisis intervention. So I'm not sure what that would involve, obviously, but once things are under control and you have sought that crisis care, then come on in and we will clear your nerve system, do an adjustment to boost your immune system, or do whatever we need to do so your body can heal and recover at its optimal. If your child has a high fever, I have had people moms and dads bring the kids in for adjustments when they are ill or have a high fever, and then go seek medical care. Because very often with that adjustment, it will reset the immune system so your body can fight more effectively. Another interesting one that doesn't happen very often, but this is a cause for immediate medical emergency intervention. It is a loss of bowel or bladder control. I know it sounds horrible. It is horrible. I have had people come in the office with that. Again, this is not a facility that can handle that. Please go seek immediate medical intervention. It is something called cauda equina syndrome. Next, car accidents. And this is a little bit tricky because very often you're in a fender bender or a worse car accident and you're banged up, you're in shock, you're confused because of the actual impact, and the ambulance shows up. They might put you on a backboard and they might just whisk you away. You go to the ER, you're laying on the backboard for who knows how long. They get some films, they say, you're fine. You might not be fine. You might not be in immediate danger, but you might have had subluxations occur that are going to cause detriment to your health and well-being over the course of the next few days, months, or years. So, when you're in a fender bender, or if you're in a fender bender or a worse car accident, is there a crisis situation? Are you bleeding? Do you have a broken bone? Is there some neurological issues going on that the EMTs are finding that cause you to need some checkout from a medical professional? If any of those things are happening, or if you have an obvious, injury, external injury, you're going to go to the ER and get checked out. If none of that is happening, if it's really just a fender bender, there's no cause for crisis intervention, you need to see your chiropractor. I have had patients go to the ER and at best been told, you're fine, and they're not. And at worst, I've had patients get the wrong information, like use heat. That is not appropriate after an injury. You need to use ice, and you need to, if that's a question mark for you, check out our video on ice and heat. All right, let's see. The other thing that's confusing for people is fractures or sprains, and they think it might be broken. Oh, I twisted my ankle. It hurt so bad. Maybe it's broken. Well, here's the thing about injuries like that. Immediately after the injury, whether it's a fracture or something like that where there's a lot of inflammation, sometimes x-rays do not pick up the fracture immediately. It takes a week or two after the injury has occurred for the fracture line to show up on the x-ray. And by the way, if you have sprained your ankle, most times there's a specific bone called the cuboid in your ankle that will drop out of position. It will take you 6 weeks to heal from that sprain unless your chiropractor adjusts your foot and realigns that cuboid bone. You will heal in 5 to 7 days. So make sure your chiropractor checks out that sprain. And there's a lot of other things we can do to help you out, like cold laser therapy and kinesiotaping and adjustments and things like that. That will help it heal much more quickly than just putting you in a walking boot or something like that. Another one, an exception to fractures is if you are over the age of 60 and you think you may have fractured something, go seek medical care, because with older people, there can be sequelae with fat nodules that get into the bloodstream from fractures. Also, if it's a hip fracture, that needs immediate medical attention. If you have a severe pain in your lower right abdomen, which could be appendicitis along with fever, vomiting, go seek emergency medical care. It may be appendicitis, it may not. It might be something doing with your hip or your back, but you need to check that out first. If you have pain so bad I can't touch you, and very often this happens when people put off getting care for something that they needed attention. If they put it off and put it off and put it off, and I physically can't touch you, you're going to need medication intervention. Or actually an acupuncturist to just get you out of that pain that you're in. And when I can put my hands on you and check you and start working on you and doing the body work that you need, great, then come on in. You could be crooked, not able to walk, but as long as I can put my hands on you, that's great. A herniated disc, don't go to the emergency room. They don't know what to do with you. They're just going to give you painkillers. So you're going to need some kind of intervention with a chiropractor. So as long as I can, like I said, touch you, come on in. We'll fix that. We'll start working on that herniated disc. If you're a work injury, this is more of a kind of insurance logistical thing. Very often they want you to see their doctor first or go through their protocol. So more than likely I can help you, but we're going to have to figure that out, how we're going to do that. So go to their doctor first if it's a work injury. If you have chest pain and you have and you're sweating and you have a loss of breath where you can't get your breath, go seek emergency medical care. But if it's a kind of chest pain where it only hurts when you take a deep breath in, otherwise you can kind of control the pain, it could be a rib out of alignment. So when in doubt, seek emergency medical care first. But if they give you the all clear, come on in, we'll put that rib back in alignment and you'll feel better very quickly. So I hope that helps. Bye for now.